Morning, everybody. This is the first day since December 22nd that I haven't had to report someone passing away of COVID-19, which is a good day. As of today, there's now 12,432 cases of COVID-19 in Albany County to date. That's an increase of 163 positive cases since yesterday. Yesterday, there was an increase to 222, and the day before that was 300. This now brings our 5-day average to new positives to 257.4 a day. Yesterday, it was 267.4. That number decreased because of the holiday with New Year's Eve, New Year's Day. A lot of these places were shut down. So you'll probably start to see the number climb back up again. It takes time. So we had that question, why is it dropping down? I wish this would go back to be the norm, but it's just the way it is because of being shut down for 2 days. There are currently 3,068 people under mandatory quarantine. Yesterday there was 3,018. Of the new positive cases, 22 had close contact to a positive case. 13 were healthcare workers. 128 don't have a clear source at this time. As of today, there's 39,428 people now have completed quarantine. Of those, 10,548 tested positive for the virus and have recovered. That's an increase of 111 recoveries since yesterday. The thing that we've talked about and continue, how the different zones have changed, red, orange, and yellow, and what we've been following here in the capital region, again, as this evolves and changes, is the hospitalizations, bed capacities, ICUs. We have 19 new hospitalizations overnight. Our hospitalizations continue to climb to records. There are now 161 people currently hospitalized from the virus. We've never had that many people hospitalized since the beginning of this, and you got to remember we're almost 10 months into it. 10 months is right around the corner. January 12th will make our 10-month anniversary since we started. Since the beginning until today is the highest that we've had. Yesterday, the high of 142 was high. The day before that was 133, with all previous records. Albany County's hospitalization rate continues to trend up. It's now at 8.55%. There are currently 24 people in the ICU, and yesterday 24 was the same number. I continue to please say to people, wear your mask, cough into your arm, clean your hands, stay 6 feet apart, only go out if necessary. If you can stay home, stay home. Don't travel if you don't have to. Support your businesses. You got curbside pickup, you got delivery now, you have a variety of different organizations doing this for free for delivery with people with SNAP and other means. So please, there's all the more reasons just to stay home. Avoid gatherings. And I know that what happened, what we chose, what we did between Christmas Eve and Christmas and New Year's Eve and New Year's Day and Kwanzaa and every other holiday that hit us in between. Unfortunately, in school being out, people got together, people socialized, kids played. Will have a consequence on us going forward. The vaccine will help when the vaccine gets out, and Dr. Whalen will talk about the pod that's being set up this week in conjunction with Albany Med and everything else going on. It's going to help, but again, it's going to take time. Educate yourself. Go to the Albany County. Go to Albany Med's website and read it. It says 6 to 9 months. CDC, 6 to 9 months, people. World Health, 6 to 9 months. You need to get 70 people vaccinated to make it effective. So think about it. It's going to take time. We got to be patient. It's not done with us. And a lot of tough decisions are going to have to be made before we get back to some type of normalcy. Just not going to happen until the vaccine's out and we continue to do the right thing. Regarding school closures, I want to start by saying my office, the County Department of Health, and our local school districts had a great working relationship before the pandemic and throughout. They have been doing an incredible job to keep the students, teachers, and staff safe since the outbreak. Dr. Whalen and her team have worked with them to prevent infections at schools and identify COVID cases and working to address the situation. As I've said before, the county does not have the authority. The governor took that away from us. I cannot shut down schools. Dr. Whalen cannot shut down schools. All we can do is advise of how we see things going on. Unfortunately, I hate to say, as we sat here for the last 10 months almost, making decisions on this, we've seen things that have happened with the curve. And usually after a school break or Halloween or Thanksgiving, and I could go on and on and on, we've seen an uptick in schools. Although Albany County's 7 to 8% positive rate is now at 10.5%. On top of that, we have record levels of hospitalizations, and December was our deadliest month ever. So I did not say the schools shut down. I said pause for a week or two. Pause, meaning learn at home, stay at home, let the infection run its course before kids go back to school, before they can spread it. And I'll get to the dashboard and talk about a lot of that stuff. COVID-19 is spreading through our community. And we need to be in this together in a partnership. And in a partnership, we'll get through it. As kids are coming back to the classrooms after being on break, likely going to holiday gatherings, possibly even traveling to different states, playing in sports, traveling with sports. Like I said, what we do today affects us tomorrow. And I've said this, I'm not here to win a popularity contest. I'm just here to put out the facts of how I see it, how it comes our way, and how we're putting it out to people. No, yeah, I'm a parent, I have 3 kids, and I get it. It's tough being at home. Toughest thing I ever did in my life when I was a firefighter was the days off in the firehouse watching my children. And that was before you had to be a school teacher. And that was before you had to do work from home, be a school teacher, be a mom, be a dad. I can't imagine the stress what parents are going through. But the decisions that Dr. Whalen and I make and everyone else is based on the safety first and foremost, not on votes. So yeah, I know I have made some parents mad, but I stand by what I said before, and I stand by it today. So we're asking school leaders to make the best decisions, consider the unique needs of their community and students' population, which the superintendents know better than me. They're in the trenches. They run the schools. They know what they need to take care of the school population. And I get all that. But if you can send your students home, consider doing it. It applies to all businesses as well. I've been saying this for 4 weeks. If you can work remote, work for remote. If you can stay home, stay home. If you can knock your companies down below 45%, do it. And the toughest thing is, as we make decisions as we go forward, you get the EOs from the governor's office, and they change the zones. So technically, if you're over 9% or 9.7, schools were supposed to shut down in the red zone. They changed the red and the yellow. That EO ran out January 1, 2021. So does it go back to that? Does it go to a new EO? You tell me. So when we sit there and we try to go through this and we're reading the different EOs and we're trying to see, all right, does it apply now to if we were in a red zone? Because we would have been in a red zone if we were following that. Does it apply to this? And try to make a decision for the safety and well-being of the residents of this county. I said that. No dollar amount, no vote, no nothing will mean more to me than saving your lives. I've said this, a temporary pause, that's it. Help us beat this curve. Help us keep people out of the hospital. Help us keep going in the right direction, and we can get through it. But it's gonna take time. It's gonna take time, and I need your buy-in. And I know it's tough on parents. I do, trust me, and superintendents, and principals, and school teachers, and janitors, administrators, everyone in them buildings, everyone that's going to work every day, I know. But you gotta be patient. You gotta remember it's a marathon, not a sprint. And we're in this together. Dr. Whalen.
Good morning. So there's a lot of information to get to this morning, but I know, the topic of schools, and in particular, the conversation that I had with the school superintendents has been getting some press, and I want to set the record straight and clarify exactly what went on the call. Again, as the county executive indicated, our department and I believe I have had a great relationship with the school superintendents during the course of this pandemic, and of course well before. We work closely with the school nurses. yearly have guidance and meetings with the school nurses before the pandemic ever began, deal with them on all reportable communicable diseases and on issues from lice to, pertussis, we'll say. But the pandemic has certainly created a strengthening of that relationship and an opportunity that we both recognize is essential for collaboration and open communication. So before the press conference on Saturday, I was reached out to ask whether it was a good idea to have a meeting with the school superintendents in light of the fact that our rates of disease in Albany County were so high. And so that was the genesis of the meeting. And then, of course, the meeting was, there were many more questions at the meeting after Saturday's press conference. And so we had a very long discussion. It was myself, Deputy County Executive Dan Lynch was on the call, and the superintendents. So I'm going to provide a summary of that because I think that the idea that this is down to it's our decision, it's their decision, we don't want to make the decision, they don't want to make, it's not serving the public, it's not serving parents, and it is not an accurate representation of what is a very complex consideration. So during the call, I started the call with a summary of what we are seeing currently in Albany County. This included the information that our cases continue to rise and that we are seeing higher numbers of cases than we've ever seen before and more hospitalizations. I discussed additional concerns related to the uptick that we have had from recent holidays and the concern that we currently don't know the impact of the New Year's celebrations and what they will have on our numbers, what that impact will have on our numbers. And this includes the school populations. I made the additional point that schools were resuming with the realization that their students may have traveled and participated in family celebrations beyond their immediate families, which does represent additional currently unquantifiable risks for COVID transmission. I discussed what we are seeing currently in the K-12 school population, and in particular what we're seeing for the last week. All of this is available on the forward-facing New York State Department of Health Schools website, and as a parent, if you want to go on that website, you can determine what the prevalence is in your particular schools. We're currently at the health department seeing between 20 and 30 cases per day spread across many districts. This is reflective of the widespread disease transmission in the community. And again, for each of these cases, we have had individual conversations with the school districts providing advice around isolation and quarantine. So given all these facts, I agreed with the concern around returning to in-person learning. I was asked, given the numbers, whether a directive would be forthcoming on cluster recommendations from the governor. I explained the county executive is also interested to learn this, and we would ask for feedback and provide any knowledge around this as soon as it became available. I think it's again important that we're very transparent, that we do not find out about these recommendations often until the time that they are made publicly on air. So at this time we are not aware, and I know the governor is holding a press conference at 11:30. There may be announcements on this. I'm not aware of it. There was feedback from many school districts asking if we had data around how many cases were contracted within the school environment. I explained that we do not have this data locally, but anecdotally and nationally, it has been suggested that most COVID spread within this age group is spread outside the school environments. This is certainly dependent on infection control within the schools. And I stated that I was aware that schools were doing the best they could to protect their children when they're in their schools. I did not at any time state that this data meant that return to in-person was safe, nor would I characterize it with that terminology. Many superintendents relayed concerns with implications of school closures, and this is really important, and this is the crux of the matter. These include children who might be unprotected from difficult home situations, including abuse. It included the concerns around rising mental health problems. It included children that may be hungry. It included special needs children that would go without services and lose essential progress. It included concerns for family welfare in situations in which parents would lose employment if they needed to stay home with children. Some of these considerations reflected lessons learned from the previous shutdown. All agreed that with these considerations, it was a difficult decision. I reinforced the idea that schools know their communities and their needs best, know their parents best, and know how they need to serve their children best. We discussed the role of parents and their input into individual situations. I asked if all the districts had plans in place for home learning so that families were able to make individual decisions. I was told that all districts offered opportunity for remote learning for parents. I offered a toolkit from the CDC that parents could use to make individual decisions to best inform the decisions for their children and their families. This link, which is a great toolkit that parents can go through, answering questions, and help them in their decision, will be posted to our website today. The pros of in-person schooling were listed and include children learning in a controlled environment with infection control precautions, less time to socialize with other children outside of school in uncontrolled environments, and a better sense of normalcy for children. The cons were also reiterated. The fact that the county's percent positivity is approaching 10%, and the unknowns after the holidays. The concerns many teachers have about risk to their own health was recognized by all as important. Finally, there was the concern that schools would open up to be closed down in the near future. This was represented as something we were all aware of as a possibility. I explained our department would be happy to discuss individual considerations of the schools going forward. As I said, and as I will continue to say, I've had a great working relationship with the district and have received feedback consistently and received feedback on that call that our department has been very helpful managing cases within the schools and partnering with the schools and the school nurses on education and infection control. And I would like to in particular highlight a member of my staff, Ryan Radigan, who has done a phenomenal job interacting with the schools and the school specialists that are working with us through the New York State Department of Health to provide daily information and conversations with the schools. The conversation ended with the determination that the decision was best left to schools. Any representation that there was a specific recommendation made or that it was said opening of schools was safe is simply not true and doesn't convey the complexity of the discussion or the many considerations that were laid out. The bottom line is that during the pandemic, in the situation we find ourselves in, solutions to questions like the safety of in-person learning are very complex. Education and public health leaders must continue to work together in a partnership to share information that will inform these individual difficult decisions. So I'm happy to answer questions on it, but I do also want to provide additional information on the vaccine. As I discuss daily, we continue daily conversations with our regional hub, planning about getting vaccine out. It is the wish, the hope, and the goal for all of us, and so far so good, that vaccine availability is the rate limiting factor. So as vaccine comes into the area, it is getting out. And we are working in a very coordinated manner to ensure that this happens. If vaccine is received by an entity, the expectation is that it will be pushed out in full supply by the end of the week. There's a tremendous amount of coordination that is taking place to ensure that this happens. And the daily calls with the regional hub and the health departments and the regional hospitals have been highly focused on ensuring that this mission is complete. It is likely, although we have not received it yet, we are told we could anticipate doses of vaccine at the health department this week. We have worked with the hub and will continue to focus on the 1A populations to get vaccine out. The state health department is providing guidance on a weekly basis. Again, I get questions all the time. What is the timeline? And the answer to that is, I don't know. This is dependent on us getting vaccine out in a timely manner. It is dependent on vaccine supply, and we are still working through the populations. Beginning the week, I had to look at the date. Every day is running together these days. Of January 4th, the prioritization will include all outpatient, ambulatory, frontline, high-risk healthcare workers of any age who provide direct in-person patient care or other staff in a position in which they have direct contact with patients, like intake staff. These populations will be available to receive COVID vaccine. All frontline high-risk public health workers who have direct contact with patients, including conducting COVID tests, those handling COVID-19 lab specimens, and those directly engaged in COVID vaccinations will be eligible to receive COVID vaccination. So we look forward to vaccinating our staff that will be participating in the vaccination effort when we receive vaccine, among other staff that other populations we will assist with vaccination. We know and have received updates this weekend that beginning the week 5 of vaccination, which starts next Monday, January 11th, vaccine eligibility will be extended to home care workers, including those in the consumer-directed programs, hospice workers, and staff of nursing homes, skilled nursing facilities who did not receive COVID vaccination through the Pharmacy Partnership for Long-Term Care program. So this is what we know. This is the extent of everything we know in terms of prioritization for the vaccine at this time. And we are very closely adhering to the New York State Department of Health guidelines in our vaccination strategy once we receive our allocation. This will be an ongoing collaboration and will require very Herculean efforts, the likes of which we haven't seen before. I think that we're up for it. I think that the partnerships with the hospitals, and in particular the leadership of Albany Medical Center as our regional hub, positions us in a great environment to get vaccine into the arms of those that are prioritized in a timely manner in Albany County and the surrounding areas, and I really look forward to doing that and being part of that going forward.
Thank you, Dr. Whalen. Appreciate everything that you do and the work that you do and for your leadership. I'm going to go to the COVID dashboard in a minute, but some of the things I wanted to point out beforehand. If you look at the age group 20 to 29-year-olds, it continues to lead the numbers of positive cases. Since December 14th, that number has grown nearly 37%. However, other age groups have increased even larger. The age group between 10-year-olds and 19-year-olds have increased nearly 45% in the positive cases. Those in their 30s had increased 64%. So one of the things, as you see the trend, as we continue to go up in the wrong way, I've always talked about the 20 to 29-year-olds. That is leading the pack going forward. But what's been alarming now for the first time ever, the 30 to 39-year-olds have taken over the second largest group, the 50 to 59-year-olds. But what's even getting more alarming is the 10 to 19-year-olds that has gone up also. So just go to our dashboard. You can look at the statistics of why Dr. Whalen and I make the decisions that we make. And it's based on the science and statistics. It's based on what we've seen for the last 10 months going on. And again, it's still the population of females is 52% versus males at 46% it's affecting and everything else. And you can go down to how many people were tested, so on and so forth, and the zip codes, but where we're at and the reality of the world that we're in. So it does get alarming when you're trying to stop the curve and trying to slow it down. We can only make recommendations. I can't thank Governor Cuomo enough for his leadership. It's a difficult time leading over 19 million New York Staters, and we have roughly about 320,000 residents in Albany County that we have to worry about. 1 million in the Capital District that we have to continue to work with in a partnership to stop the spread. What's going on in Schenectady, Rensselaer, Saratoga, Columbia, and I could just go on. Again, working together to make sure we protect everyone in the region. So things do change, things do continue to evolve, and we're almost there. So please work with us, help us. Let's be part of the solution. Again, not part of the problem. We don't need finger pointing. We just need to come down and work together in a partnership. So at the end of the day, it's not us against them or them against us. We have great relationships. Dr. Whalen and I and her team and my team have worked hard to work with everyone. We know the strain that everyone's under, and not just the school districts. I'm talking businesses, I'm talking restaurants, I'm talking everyone. We know the strain of resources and everything else. We're almost there. The light is at the end of the tunnel. Let's get there together, and let's stay strong for the next couple of months. So to wrap things up, I want to remind everyone about the application through the partnership with Albany County Legislature and the Community Loan Fund is still available. To go to the website. The deadline to apply for up to a $5,000 grant is the 19th of January, so please check that out and to get tested. You know, please, everyone go out there, get tested if you can. We have great partnership with Whitney Young, 518-465-4771. We pay for it if you don't have the insurance. UAlbany initiative, that is free. You don't even need insurance. Please call them at 188-364-3065 to schedule appointments. And go to our Albany County website, and you can look at the times and the places and the age groups and the categories. And thank you to all the partnerships that we have there. Again, for mental health support, please call if you need it. The world's different, especially with your children. Dr. Whalen brought up a good point. This is affecting kids hard. You got to think, since March 12th, out of school, pretty much since the middle of March. Some came back, some are still out. It's tough. And not that socialization and not being able to be a kid or finish your sports, whatever it may be. Please take the time to talk to your kids. Parents, don't be afraid to pick up this phone and have your children talk to someone else, because sometimes your kids just don't want to talk to their parents. So again, mental health support is available 7 days a week, 8 a.m. to 5 p.m., 518-269-6634, the 24-hour sexual assault hotline number, the 211 in New York State hotline. Please stay safe out there, wear a mask, cough into your arm, clean your hands, stay 6 feet apart, and we'll get through this.